All right, let's get started. Thank you all for joining this webinar today and taking this time. Just so you know, the webinar should generally run around 45 minutes, and then I'll be free to answer any questions afterwards. But if you do have any questions throughout the webinar, I'd absolutely encourage you to interact with myself during the webinar, and you can do that either by asking a question in the question box or a chat in the chat box. Or you could raise your hand with the raise your hand button, and I can unmute you and you could ask me your question out loud. Everyone is currently muted except myself. So today's webinar is an introduction to the Gateway to Global Aging data, and somewhat more generally, an introduction to harmonized aging and retirement studies around the world. So this is going to be a really brief overview for people who perhaps have not used some of the harmonized global aging studies, aging and retirement studies around the world, or who haven't used the gateway to access them. So the Gateway to Global Aging Data is a web-based platform for population survey data on aging around the world. It's a free and public resource. It's publicly funded by the NIA in the United States, and it's designed to facilitate cross-national and longitudinal studies on aging using the family of health and retirement studies around the world. And it's available at www.g2aging.org. I'll briefly, and throughout this webinar, I'll be actually showing you the website. So I'll show you kind of our landing page here. This is at g2aging.org. And today we'll kind of walk you both through the surveys and some of the gateway and then some of our data products. So first, let me familiarize you with health and retirement studies around the world. This is a network of studies which are designed to collect information about aging in a similar way in different countries around the world. And all of these studies are partly funded by the National Institute of Aging, which is one of the National Institutes of Health here in the United States, even though they're conducted around the world, for the purpose of being able to see how different policies affect aging, because of course there's different policies in different countries, and as we might all know, the global population as a whole is aging. So it's something that many people are studying and concerned about learning what are the best practices. So starting in 1992, a study was started in the United States called the Health and Retirement Study. It's conducted out of the University of Michigan. And this study is conducted every 2 years. So they started interviewing as a nationally representative sample, and they interviewed people who were aged 51 or older. And then they would come back to them and they would re-interview them every 2 years until end of life. And then at end of life, if they came back and the person was no longer living, they would have an interview with the next of kin to find out about what was the situation around their death and what was the time in between the last interview and the death like for that individual. So following this model, many countries have also started this study, as I said. So those include Mexico, England. There's a study called SHARE, which includes more than 20 European countries. SHARE has continually added more European countries since its first wave. In a longitudinal survey, a wave just indicates maybe one interview. Wave 1 is considered the baseline, the first time you interview anyone. And then wave 2 is kind of that next interview. Korea, Indonesia has a study. Japan has a study. The World Health Organization, the WHO, has a study called SAGE, which is the study on global aging and adult health. SAGE includes China, South Africa, Ghana, India, and Mexico, and Russia. There's a study called TILDA, which is in Ireland. There's a study in Costa Rica, a study in China, and a study in India. So some of the key innovations in these studies are that they're multidisciplinary in subject matter. So this is not just an economic study. It's not just a study about people's health. or people's demographics. The idea is that we can capture a lot of different facets of people's life, because of course these conditions which affect aging and longevity and end of life are multifaceted in themselves. We know this. One of the other key innovations in these studies is that there's enhanced quality of economic data. So one of the problems that often happens with collecting economic data, for instance, how much money do you have in a retirement account, is there's a lot of non-response. People will say, well, I don't actually know how much it is. And this non-response is somewhat biased, right? So it's quite easy if you don't have a retirement account to say, well, I know that there's zero in there because I don't have one. But it's these people who do have one, or perhaps have multiple retirement accounts, that are more likely to leave this value missing. And if you conducted your analysis leaving these people out, your results would be somewhat biased. They'd be overrepresentative of people, for instance, without retirement accounts. So what these studies did to address it is they use unfolding bracket questions. So when someone says, I don't know the value in my retirement account, then the interviewer who they're speaking to says, well, is it more or less than $50,000 or about $50,000? And they can say, well, I know that it's more than that. And they can say, okay, well, is it more or less than or about $100,000? And they could say, well, it's less than that. So what that does is for a data user or a researcher, it gives you a range which you know that the true value lies inside of. And inside of that true value, you can then impute, which means to assign a value where a value is missing. So you can assign a value. So let's say if we knew that the range was between $50,000 and $100,000, we could assign a value of $75,000. And what that does is it allows us to still include that person in our analysis. And generally, the best imputations are done in a way that don't bias your results by assigning these values. And for most of these studies, they do provide already imputed values. So it's not something you have to worry about yourself, but it's really nice that you know that your estimates are not going to be biased because of non-response for economic questions. These studies have also integrated biomarkers into social surveys. So these include things like height, weight, waist circumference, blood pressure, and then a lot of them take blood specimen. Some of the core content areas, as I mentioned, they're multidisciplinary and include demographic questions, health questions, health services. So what are people spending on health services, work and employment. This includes retirement, when they retired, what were the conditions of their retirement. A lot of economic questions, as I mentioned. And there's also questions about family structure and social network. So how much time do they spend with their family? How close are they to their family? How often are they involved in their community? And then questions about is there kind of a family exchange, right? Or are they giving money to their children or their grandchildren? Are their children or their grandchildren giving money to them? So as you can see, there's a lot of studies conducted all over the world. In the US, since it started in 1992 and we're in 2018, it means there's like 13 waves of data just for the US, and there's lots of different research domains covered in those, so it's a lot of data. So what the Gateway was designed to do was to kind of be a central place for anyone looking to access all of these data together. So this includes a library of all survey questionnaires. We build flowcharts to illustrate the questionnaire skip pattern, which is really helpful, and we'll look at that. We have a Concordance Search, it's a search function. We built interactive graphs and tables, so you can actually get some estimates, some population estimates out of the data before downloading it yourself. We have a lot of documentation on cross-study and longitudinal comparability. We have a catalog of publications based on HRS family of surveys, so you can easily find other research which is done using a particular study and looking at something like cognition. And then lastly, we build harmonized data sets. And this is what users of the Gateway often find the most useful. So when I say harmonized data here, I mean that the data are cleaned, they're provided in a very user-friendly format to data users. And they're coded exactly the same. So for instance, the gender variable for every single one of these studies is going to have the same name. The same code is going to be, it's going to be 1 for male in this case, and it's going to be 2 for female in this case. So they're very user-friendly for doing cross-country or longitudinal analyses. So first, let's look at our library of survey questionnaires. So the Gateway provides detailed information about all parts of the survey. That includes the location of all survey items inside the interview, survey questions, including question text, interviewer prompts, answer types and choices, how the question was asked and to whom, and how those values are formatted inside of the microdata. So let's jump back to the Gateway. And if you click here on this first tab, which is Survey, you can first see a list of all the surveys. So I mentioned the HRS started in 1992 with Wave 1. And then in 2016, they conducted their 13th wave. So there's 13 waves of the HRS. You'll notice that MHAS in Mexico started in 2000. So their Wave 1, what they call Wave 1, is 2000. So this chart is helpful for making sure if you want to look at something in the same year in different countries, that you're using the right wave of data. But let's go into this. So let's look at SHARE. That's that European study. We could look at SHARE Wave 2. Inside of this, we have survey modules, and surveys are usually broken up into different questions, which are grouped into topics, and that's called a survey module. We could go into the behavioral risk module. We could just look at our items here, so you can see that we have lots of different items, and then we could go into this ever smoked daily question. So you can see for this question, the question text is, first the interviewer says, the following questions are about smoking, drinking, and drinking alcoholic beverages. Have you ever smoked cigarettes, cigars, cigarillos, or a pipe for a period of at least 1 year? So also notice this is in English. Even though the SHARE survey itself is not conducted in English in any particular one country inside of Europe, just based on the countries that it covers, everything on the Gateway is translated into English. So it's helpful for maybe accessing surveys that are conducted in different languages. We let you know that the answer choices are a yes and no and how they're coded. It's a 1 and a 5 for yes and no. You can also see concurrent items. So BR001, BR001. So this same item is asked at different waves, and you could link to that. I'll briefly just jump back to the Surveys at a Glance tab. So this is what is called a core interview, and that's that main interview. But there's a few other types of interviews which are conducted. One is a self-completion interview. This is something that's mailed to or given to the respondent after the interview to fill out on their own. These interviews are sometimes helpful for questions that maybe we think that an individual might not want to answer out loud to an interviewer. Some of these studies have a life history survey. And this is a really in-depth survey that goes through someone's entire life and says, okay, well, tell me about your first job you had. Tell me about your second job you had. Tell me about your third job you had. And it goes through someone's entire life that way for many different domains. As I mentioned, there's biometric data. So there's health assessments for all these people. Often a nurse comes to conduct these at these people's houses. And then, as I mentioned, there's exit interview or end of life interview. So when the interviewer comes back and says, I'd like to speak to John Smith, and someone answers the door and says, well, John Smith, he passed away last year. And they say, okay, can we interview the person who would know best about the time at the end of their life? And that's called an exit interview. We've also developed flowcharts. And these flowcharts are very helpful because one of the things that these kind of surveys do is there's what is called survey skip pattern or survey logic. And this saves a lot of time for both the interviewer and the person who's giving their time to be interviewed. So for instance, here's that question we looked at before. So the question of ever smoked daily, right? And if someone says yes to that question, the next question they get asked is, do you smoke at the present time? And they're not asked, do you smoke at the present time, if we know that they never smoked. So it just saves time. These, of course, get much more complicated. For instance, how many pensions do you have? and then based on how many pensions they have, they get asked certain questions. For a user, a data user especially, it's really helpful to know why you might have missing values. So for instance, if you were only to look at the variable in the data set for this question about smoke at the present time, you would have a lot of missing data. And that data is missing because we know that they never smoked ever, but it's not included in that variable. So you have to often account for, as a data user, all the questions that might have determined the skip pattern to lead up to that question. So we built flowcharts for all these surveys also. We build a concordance search, and that's just our search function. And we do this because this is generally how people use the internet, right? They just search through the internet. So users can identify comparable survey measures between all health and retirement studies using keyword search, top-level research domains, and finer research topics for harmonized data sets. As I mentioned, those harmonized data sets are those user-friendly versions of the data. And the harmonized data sets don't have all of the items that exist inside of the survey, but it's those items which are most comparable and most frequently used for research. So let's go to our concordance. I see concordance here across surveys on the Gateway to Global Aging data. So for instance, let's say that we're interested in searching for a height variable, and we're doing our analysis looking at Charles. So we click on Charles. Once we click on Charles, you can see that we have options here of which years we have data for Charles. So we can say Charles 2010, and we can search that. And what you can see is that immediately we get a list of questions which relate exactly to the knee and height. And you can see there's several ones of them here. Some of the questions look like they're for the interviewer. From here, you could jump into, they look like they're all from the K module. So you could jump into the K module and you could see all the individual questions either in flowcharts or in the code book. You can see here it's provided both in Chinese script and in English. Or you can just look through the module items and you can see these questions that are asked. As I mentioned, for harmonized data sets, these cleaned user-friendly data sets, you can select from finer research topics. So for instance, let's click on the harmonized ELSA here. That's the harmonized user-friendly version of the English data from the study called ELSA. We could say we're interested looking at 2006. And then we can say we're looking for a variable, in this case, not a question, because it's not from a survey, it's from a data set, a variable for the number of children. And we can search for that. What you can see is that immediately we get these variable names for the harmonized ELSA. And you can see some things about the harmonized data set right now. So because 2006 was wave 3 of ELSA, all of these variable names have the letter 3 as their second character. We have both respondent and spouse level variables, and we have number of living daughters, number of living sons, and number of living children. So immediately it's quite easy to find things by searching through it. For many of these studies, there's no way to just generally kind of search through any of the surveys themselves without going through individual PDFs and using the search function. So this is an especially helpful function for researchers. We also include a lot of documentation because of course the search isn't going to give you all the answers about everything that is different. So our documentation come in two main forms. One is domain-specific comparison tables, and the other are domain-specific user guides. And they're both available on the documentation page for the Gateway. So if we click here on the documentation page, first you can see these are our tables. So for instance, let's say that we're interested in looking at cognition. So we can go to our cognition table. And what this does is it lists most of the frequently used cognition questions. So you can see here we have a question about self-rated memory or memory compared to the last 2 years / last interview, self-rated writing reading skills, immediate word recall, delayed word recall. And then you've got information about whether it was asked and if there's any differences about how it was asked. So for instance, immediate word recall. So this is generally a list of words that the interviewer will read to the respondent, or sometimes the computer will read to the respondent. And then they say, can you tell me how many words, repeat those words back to me that you recall, that you remember. So that's the immediate word recall. Usually there's a second part of this test called delayed word recall. So they kind of move away from that interview. They ask some other questions about some other things. And then they say, do you remember that list of words that I read to you earlier? How many of those words can you remember now? So this is a cognitive test. It's to test people's verbal memory. One of the differences you might see in different studies is that a different number of words is used. So for instance, in the HRS, 10 words are generally used in waves 4 through 12. In MHAS in Mexico, only 8 words are used. ELSA, we use 10 words. SHARE, we use 10 words. CLOSA in Korea only uses 3 words. JSTAR in Japan uses 10 words. So it's going to give you a really quick overview of what those differences are. So say we wanted to use this test, and I wanted to know just which studies I can use to compare this test exactly, perhaps the 10-word test, right? So I know that I can use HRS, I can use ELSA, I can use SHARE, I can use JSTAR, I can use TILDA, and I can use Charles. So it's all right here in one table. As I mentioned, we also have working papers, and those are on cross-country comparability. And we have these for, I'll jump back to my slide here, for several different research domains, including chronic medical conditions, all the way through physical and anthropometric measurements. And these are really in-depth kind of user guides that are written by researchers in this field, and they go through every question that's asked. They suggest, they highlight those differences in the questions that are asked, and they suggest how different researchers deal with these differences. So these are really helpful, but much more in depth than the comparison tables. I would say start with your comparison tables and then look at the user guides. We've also developed interactive graphs and tables. We wanted to give users a way to play with the data, to generate some estimates from the data without going through the issues of downloading the data itself, structuring it correctly, and then dealing with population weights. So this is available on our graphs and tables data. And you can see when it populates here that we have 2 graphs, and this is whether working for pay for England and the US for different age groups. And you can see here we're looking at between the years 2002 to 2014, again, because these are longitudinal. So these are kind of repeated cross sections of these years. One of the things that you can see in this graph here is that for this group in England, people aged 60 to 69, in 2002, we would estimate around 26% of the English population who were 60 to 69 were working for pay. But then by 2014, 36% of them were. So that's really quite an increase. You can see compared to the US, there's a little bit of an increase, but it looks like much more slight than what you see in England. So this is a good way to kind of compare things across country. These are population estimates, which means they're already included the population weights provided by those surveys to produce these estimates. Any of these graphs and tables can be downloaded in several formats. So this is kind of our graph here. We also can see this in table format. The table format includes some helpful information like the standard error and the n that was used to calculate that, that estimate, so you can make sure we're not getting any cells that are too small. I'm going to show you a couple more of these graphs and tables. So this is any financial transfers from children in 2012, and you can sort this, of course, just by magnitude here. So you can see it's really low in some European countries like Spain, the Netherlands, and France, and Slovenia. And it is really especially high in developing countries like Mexico, China, and Korea. Here's a graph where we compare men and women, and it's whether they're currently working for pay in 2002, so just 1 year here, for people aged 50 to 59. So we're looking at the gender imbalance and who is working, perhaps. You can see that in Sweden, it's like par for par, right? There's no, using our kind of confidence intervals here, which we show, there's no statistically significant difference between men and women for pay. It looks like in the US, there might be a little bit with women working a little bit less. But then in a country like Mexico, you see a really stark difference in women working for pay. And it's not even as stark as for instance, China. Mexico, you see this really stark difference. And as I mentioned, we also have tables. So this is a household net value of primary residence. Anytime that you produce an estimate for different years that has financial variables, everything is already inflation adjusted. So everything that's shown is in 2010 dollars here. And this is household, the value of the primary residence. So the value of the house minus the value of the mortgage, right? That's the net value. And one of the things that you can see here as we look over different years is you can see the effect of the housing crisis here in the United States. So you can see in 2004, it rose. In 2006, it rose past 2004. In 2008, it rises just a little bit here. If we look at the mean, not similar. 2010, it's really dropped down. 2012, it is still dropping, and it's down to levels that we didn't see until 2000. And then in 2014, it looks like it starts to tick up again. So you can really see because this is national representative data, you can see some of these trends that we know happen in different countries. You can also produce maps. So for instance, this is a map with the percentage of men with less than secondary education in 2012. You can see that that is very high. For instance, here in France, it is low in Germany, it's high in Italy. There's a lot of countries which still do not have this data available, so those are in gray here. But especially for Europe, because of the SHARE study, a lot of these countries are covered. We also have a catalog of publications. So one of the best ways to get started with doing research is to see what other people have done. You don't want to reinvent the wheel, and you also want to be able to learn from other people. So we've built a catalog of publications. So we can go to our publication tab here. So let's say, for instance, that you were interested in using MHAS, so the Mexican data, and you wanted to look at cognition. So we're going to click cognition here. So survey cognition. And then what I'm going to get here is a list of published analyses which are using cognition, which use MHAS data. For any of these, we can find out more information. You can get a direct link if it's available to that article, or you can just get a link to Google Scholar, because perhaps you can access that article through your institution. For any of these that you select, you can also download and export these entries in text, CSV, or EndNote file. So this is really helpful. In addition to kind of these select functions, you can also search by author's name. So we can search for Crimmins, who's a researcher here in the United States. And we can find all those papers which Eileen has written. This is comparable to using Google Scholar or PubMed. The advantage of using this publication search is that it's tied to the data that they use, which is sometimes hard to find on Google Scholar or PubMed without reading through the paper itself. So we really go through a lot of time and have people go through these papers and identify papers specifically using these data. And that can be very helpful. So lastly, let's talk about harmonized data. So harmonized data sets are created to provide harmonized measures of HRS type studies. The harmonized data set is not everything that is asked inside of the survey, but it's a subset of that survey, which is most easily comparable between different years and between different studies and most frequently used. So we kind of use as our model for these harmonized data sets the RAND HRS. And the RAND HRS is this version of the HRS which is wildly popular. Almost all of the research that comes out of the HRS study uses the RAND HRS because it's so user-friendly. So like the HRS, the RAND HRS, all harmonized data sets have all waves combined into one data set, and each individual is one record. We do that by using a variable name convention, which we saw earlier. So variables include the year number. So you have a variable like R1 work, which is whether the respondent is currently working in wave 1. And then you would have a variable like R2 work, which is whether the respondent was currently working in wave 2. This means this data set is structured as a FAT file, so it's very wide. We also include country-specific variable names. So for instance, let's say that a similar question was asked in a different survey, but perhaps the answer choices were different. We're not going to give that the same variable name because we don't think it's exactly comparable. But what we will do is we'll provide that variable, and then we'll do something like we'll give it an underscore C, for instance, meaning it's Charles specific in this case. And that's this example here is R1 labor force underscore C. And that's the respondent's labor force status in wave 1 of Charles, because they used a different response scale than they did in the RAND HRS, just reflecting different employment and institutional differences between the US and China. We also produce spouse versions of most variables. So for instance, a variable like S2 work is whether the respondent's spouse is currently working in wave 2. This is really helpful if you want to look at family effects, because both the respondent and the spouse are interviewed, but sometimes that means you have to go through an extra step of spouse matching, and we've kind of already done that work for you. So just very user-friendly. One of the other things that we do in harmonization is we account for survey skip pattern. So for instance, you can see here in a very simple example, perhaps we wanted to make a variable about whether the respondent smokes now. So we need to account for two questions in that. First, the question of ever smoked, and then the question of do you smoke at the present time. So we know that people who said no to ever smoking and people who said they don't smoke at the present time, meaning they smoked at some time in the past but not now, should be coded as 0 for a no. And then anyone who said that they smoke at the present time should be coded as 1 for a yes. Again, our coding is going to be consistent across all harmonized studies. So 0 is always a no, a 1 is always a yes. It makes it really easy to do these comparisons without having to worry about accounting for some of these other differences. Since I showed you a very simple example, I'm going to show you also a much more complicated example. So for instance, let's say we were interested in the JSTAR using the Japanese data in making a household assets, just the savings component of household asset. So this is asked both in the self-completion survey for JSTAR and in the main interview, the CAPI. And there's lots of skip patterns that you have to account for here. So based on whether you have this account, based on whether you and your spouse hold it together or separately, changes how this question was asked and answered. So all of these have to be accounted for. You can see here on the bottom also for JSTAR CAPI that if they said they do have the account, but that the value is missing, then you get these unfolding bracket questions. So do you have more or less than blank ZIN and savings? And then you see it again and one more time. Why it's blank here is because in JSTAR, they allowed the interview to come up with a value, which could be helpful. I mean, they're standing usually in their house, so maybe they know a better way to, the amount of yen to start with, so they're not kind of going off no information. But it means that it's a lot of work to provide these imputations, and that's already done for anyone using the harmonized data set. We've already looked at what was the range that they gave us based on what the interviewer said for that respondent, what the interviewer asked for that respondent, and we assign a value so that it doesn't bias your estimates. This could be maybe a week or two of work. This, of course, is just maybe one of 10 parts of household assets. This is just having a savings account. There's a lot of other assets that we need to ask about. So, for instance, maybe you're not interested in how much they have in their savings account. You just like to know total how much they have in household wealth, right? That could take months of programming, but here we've done that for you. So we'll provide just a total household wealth variable also, and you can use that knowing that was constructed in a way which is documented and which has been agreed upon, in this case by economists. We produce a lot of documentation in our harmonized codebooks about how things were done for each harmonized variable. So each harmonized dataset is accompanied by its own codebook. The codebook includes a brief overview of statistics for each variable. It details variable creation and any assumptions made in the creation. We highlight any differences between waves for this harmonized variable and any differences between this variable and the RAND HRS variable. So we always use the RAND HRS as our basis for comparison for explaining differences between different surveys. And the last thing that we do is we list all the variables from the originating data set that were used in the creation. And we do this to be as transparent as possible because we want to let you know, perhaps you don't kind of agree with maybe some assumption we made, or because of in what you're particularly studying you want to structure that variable differently. So we've given you the list of all the questions we used. For all of the harmonized data sets, we also provide the program that we use to create the data sets. You can actually just copy the code, for instance, for just one part of it if you wanted to, or just tweak our code to better work for you. Here's an example of a harmonized codebook. So this is smoking in the harmonized share, that variable we looked at. So we produce both an ever smoke and a smoke now variable, both for the respondent and for the spouse. We provide some general descriptive statistics. These are not population estimates because we have not applied those weights yet, but they give you an idea of how the data is distributed inside of the data set. Because this is a categorical variable, we'll give you counts or tabulations for each of these. Again, you can see that a no is always a 0 and a yes is always coded as a 1. We also use special missing values, which are available in SAS data and SPSS, to give you more information about why a value might be missing. So for instance, it could be that the person said they don't know. It could be that they refused to answer, or it could be missing for maybe some other reason we don't know. Perhaps they didn't make it this far in the survey, they dropped out at some point. So these can be helpful. And then we provide a lot of text. So we tell you exactly how the question was asked in the survey, any assumptions we made in creating the different variables. So we list all that out here. We highlight any crosswave differences. So if this variable changed in any way between different waves of share, in this case there weren't any changes. And then we list differences with the RAND HRS. And I'll briefly highlight this here because we do see a difference. So we say here in the share, respondents are asked whether they've ever smoked daily for a period of at least 1 year. In the HRS, respondents are asked whether they have ever smoked, regardless of whether the smoking was daily, and not given it a definitive period. So depending on what you want to model or capture with this variable, you might be getting something different. The HRS version of this variable, you might pick up someone who went to Italy for a month in a summer and took up smoking for that month, right? And if that person was in the share survey and they only smoked, let's say this is someone in Italy who went to the US, they picked up smoking in the US for a month, they would answer no to this question, whereas they would answer yes for that person in the US who had gone to Italy. So depending on what you're capturing, it could be differently. If you just want to capture some general long-term exposure to smoking, you might be getting kind of the same thing, but it might be kind of different if you're looking at kind of risk-taking, for instance, with behavioral consequences. And lastly, as I mentioned, we list all those variables used. So these are the share variables used. Of course, we see this is our value from the harmonized, our variables from the harmonized JSTAR. This is a much more complicated one. You can also see that because we provided imputations, one of the things we produce also is an imputation flag. And that's helpful so you can know exactly where that value came from. So you can see continuous value here means they gave you an absolute value. They said, yes, I have a checking account or savings account, and this is how much I have in it. We could have a complete bracket, meaning they said that it's more than some number of yen and less than some number of yen. You can have an incomplete bracket, meaning they gave you one of those. They said, well, basically the interviewer got to say, well, it's more than it's more than 200 yen, but that's all we know. We can know that they said, I don't have a savings account, and they'd be assigned a value that's 6 here of no asset. There's also people who say that they don't know that they have an account, and in that case, a value is assigned to them, and that value could be assigned of not having an account at all or having a value for that account. And there's also in JSTAR, there's top coded values. So there's some values which JSTAR decides they're high, and they're high maybe in an identifiable way. So they top code those. So we flag those all here for you. Again, we try to be really transparent about everything that we do. As you would guess, the how constructed text is much more complicated, and the list of variables used is much more complicated for this. So currently, here's all our harmonized data files. We have a harmonized HRS, which is a supplement to the RAND HRS. So it's variables which are not included in the RAND HRS, and it incorporates the first 12 waves of the HRS. And then going from there, we have harmonized data from England, from Europe and Israel, from Japan, from Korea, from Mexico, from Costa Rica, from Ireland, from China. And we have from the pilot version of the Indian data set, the LASSI, we have harmonized LASSI. And the harmonized data sets are either distributed through the gateway or by the originating study. And in some cases, the data files are created by the users based on the code provided by the gateway. So if we go to our website, on the Downloads tab, you can figure out exactly how to get each harmonized data set. So you can see all the studies that I mentioned here. The first thing we have is a link to download the survey data. So if you want the original survey data, you want to register for that, you would follow that link. We have links to download the harmonized data sets. You can see in two cases, we say in the case of Share and CLOSA, the European data set and the Korean data set, see data code below. You can download the codebook here, which is very important. So you have all the documentation about that data set. And then, as I mentioned, we also always provide this data creation code that was used to create the data set itself. And in the case of the Share and CLOSA, Harmonized Share and Harmonized CLOSA, this data code is how you're going to create that data set. You're going to download, for instance, for Share, all of the Share data from Share first, and then we give you a code which you have to only edit maybe 2 lines of just to say where you've stored that code and where you want your harmonized data set. And you can run that once using Stata, just once, and then you have the harmonized Share in this case. And you can then convert that to SAS or SPSS or R or any other data set format that you'd prefer to use that in. So we do encourage you to register for many of the functions like downloading the documentation or accessing the harmonized data. You do have to register. Registration is really simple. You can choose register in the upper right corner of the website. Currently I'm logged in, but if I logged out, I would see here I could click register. And it's very simple. It's just your first name, your last name, your email address, your country, and your institutional affiliation. This lets us keep track of who's using the website so we can continue to prove that we're being a valuable resource to people. But it also allows us to communicate with you about data research updates. So every time a new wave of data comes out and we incorporate into a harmonized data set, we let you know about that. Those kind of announcements. Every time we have a webinar or we're attending a conference, we let you know about that. So you can learn more at the website itself, g2aging.org. We also maintain a help desk, and that email is help@g2aging.org. You can email that email address anytime. We always try to get back to you within 24 hours. There's a team of people who work on the gateway here at the University of Southern California. So we kind of farm that question out to who's best to answer and get back to you. And these can be questions that are saying, I'm just having trouble getting around the gateway, or can you explain this to me, perhaps where I can find this once more, or questions about, I'm interested in studying blank in these countries. Can you point me to some information that might help me get started? And we're happy to do that. I'll also briefly just say we have one upcoming webinar, which is next week, Tuesday, May 8th. And this is an advanced data workshop. So now that you know about the gateway and you know about harmonized data and the HRS family of surveys, if you wanted to see kind of an example of actually doing some cross-country analysis with one of these harmonized data sets, this would be a great place to start. So it's 8 a.m. in LA, 11 a.m. in New York, and 4 p.m. in London. And we definitely encourage you to join. We're going to be using the Harmonized Share for this, and you can register at the gateway. It's at g2aging.org/webinar, and you can register there, perhaps where you also registered for this webinar. So that wraps up today's webinar, this introductory webinar. I hope you all enjoyed it. If you have any questions or comments, I will be hanging out here for a little while. Also, as you sign out and you get maybe a follow-up email, there'll be a link to a really brief, maybe a 10-question multiple choice question, just kind of survey about the webinar. I'd encourage you to fill it out. You can let us know if there's anything that you particularly liked or disliked about this webinar. But thank you all for taking time to be with me today. And I do encourage you to use the Gateway, and it's a wonderful resource for anyone doing aging or retirement or health research around the world, especially looking at things that are happening globally. So I'll be hanging out answering any questions, but thank you again.